I'm Dr. Simon Chan. I've been a medical doctor for the last 30 years. It's been such a wonderful journey that I would be able to help patients every single day in the last many years of my life. And for the last 20 years or so, I've been also helping students on the weekends. Young high school students apply to Ivy League schools, or some of them actually apply to BSMD, combined programs. And lately, more and more students are interested in applying to medical schools, so my job has been very much involved with college students applying to medical schools. Right now, I have 5 such college graduates working with me with various backgrounds. But on interviewing them and also in interviewing their parents, and sometimes it makes me very nervous because too many of them actually always say that I have a GPA of so high, I have an MCAT score so high, so I don't need much of your consulting, counseling, Dr. Chan. I just need you to look at my essay. That's it. So I go back, I look at their prerequisites, also look at their pre-medical work, and many times I come back to tell them, wait a minute, in your preparatory work, there are quite a bit of so-called holes, difficulties, and also myths in your preparation. Don't just rely on your GPA and MCAT, MCAT score, because the countries that will allow high score to become a medical student would be, for example, Hong Kong, China, maybe even the UK, Great Britain. But in the United States, medical schools, we require a lot more. So today I want to talk to you about how to get out from the myths of preparatory work in medical school and the application. Today I will also teach you a few things concerning the success factors that are absolutely needed and embedded in your preparatory pathway to be successfully able to get into U.S. medical school. So let me show you a couple of students first. Student A, GPA 4.0, MCAT, wow, very good, 520. Highest score is about 528. Good score would be about 516. Clinical experiences, riding in ambulances as a EMT, helping emergency patients, and hospital volunteer in the emergency room, watching doctors how to take care of emergency patients. Research project, because of this particular student said that I have a 4.0, I have a 520, I don't need anything else. So no need to do research project, done. And on the essay to the medical school application called AMCAS, AMCAS, he wrote about his interest in helping people. Medical school apply, only 15. Good number, but not absolutely the most desirable number. Interview, because no interview, no acceptance, right? In medical school process, in this particular student, he applied to 15, he got none, no interview. There must be a reason, isn't it? Therefore, my definition of critical success factor, there are 6 of them, which I will talk about a little bit later in this talk. This student, besides GPA and MCAT, nothing else. He is relying on his high academic score to go to U.S. medical school. Unique differentiation, something unique about him, nothing much. Competitive edge, nothing much. Medical school acceptance, in his case, not even one interview, of course, not a single acceptance. This student, I hope by this time he should be able to listen to me and learn a lesson on how to prepare for medical school education and the application process. Student B, GPA a little bit lower, 3.8, not bad at all. MCAT 518, which is right about the screening point. Clinical experiences, a lot. She served as a patient coordinator for cancer therapy clinical trial in a major medical center. It's a cancer center. She also did a research project on computational analytics of various cancer drugs. That means to decide statistically on which cancer drug is good for which type of patient. Not just which cancer drug is good, but which cancer drug is good for what type of cancer patient. an MCAS essay she wrote about future application of artificial intelligence, machine learning in precision medicine, personalized medicine. Medical school applied 40. Even though she had very good preparation, she still put in the effort, put in the time. Interview, remember, no interview, no acceptance. Interview, only one. Even though with her very significantly good preparation, she had only one school interview. I reassure her at that time. I said, don't worry, you should be fine. All we need is one school, okay? One school interview, you will get into one school. Her critical success factor, besides all that good GPA and MCAT, she did have all the other factors. So she totally had 6 critical success factors, which I will talk about in a minute. Unique differentiation, yes, she had a lot of data analytics in medicine skill, competitive edge, competitive advantage. Yes, she did have AI in medicine that she understands very well and know how to use it. AI essentially is everything today in science and medicine, maybe even in daily living. Medical school acceptance, she had 1 interview, remember, and of course, 1 acceptance. She had 100% acceptance. 1 school, 100%. I told her, don't worry, because you do have 6 critical success factors all prepared, and you did well. Many days, many times, every student and family and also parents ask me, how do I do it? What do I do? I've done so much already, so please tell us how to do it. Medical school in the United States is not easy to get in. I will tell you more in a second about the statistics in U.S. medical schools. I'm a stomach, colon, internist doctor. I work at UCLA and Cedars-Sinai for many years. I help students go to Ivy League schools, BSMT combined programs, as well as medical schools. And I have worked at Princeton University, Mount Sinai Medical School, and UCLA Medical School as a medical review, as well as admission review, as well as interview admission officer. I worked for 30 years as a medical doctor, and I have about 20 years or more of admission process experiences. Today, we will talk about 5 different topics. Let me go with them one by one. Let's start talking about U.S. medical school statistics. 80,000 total medical school applications every year. 30,000 first-year class medical school matriculants. These are the students going to U.S. medical schools. 50,000 MD applicants out of 80,000, 20,000 MD first-year class matriculants out of 30,000 total number of medical school matriculants, because we also have the Texas application system. We also have DO, Doctor of Osteopathic Medicine medical school system. So the MD, allopathic medical school system, we have 20,000 students entering every year. 45% MD overall acceptance rate. This is a little bit misleading, which I will explain in a second. 20,000 DO applicants overall, 9,000 entering every year, and 42% of these people will be entering the first year class overall every year. 6,000 average number of applications to each U.S. medical school. That means, let's say Harvard, Stanford, Columbia, they will see about 6,000 people apply every year. Not a huge number, but of course the problem is they only take about 100 to 150 students every year. So the number is very small, especially to the good medical schools. So therefore, to top 10 medical schools such as Harvard, Yale, WashU St. Louis, Columbia, Johns Hopkins, they only take 2% of their applicants, 2% acceptance rate to top 10 medical schools. To the top tier medical school, the acceptance rate is about 5%. That means to Mount Sinai, Dartmouth, Brown, Boston U, etc., etc. 10% accepted into state medical schools. So let's say you're from a state of Kentucky, you absolutely should apply to your own state school, University of Kentucky, because 10% of you will get back accepted into your own state medical school. So the real number of school acceptance to medical school is really 2, 5, and 10, and not the overall 42. That is a little bit misleading overall number. But of course, most of our students would like to go to top 10, top 30, as well as to their own state medical schools. 3.8 is the magical number, GPA to get into medical school. 518 is a magical MCAT score that will get you into medical school. So please work hard. 80,000 is the annual medical school tuition. 200,000 is the amount of debt loans that you will have to incur for 4 years of medical education. But overall, remember, okay, the average number of medical school each applicant can get admitted to usually is only 2. You can be a star student from the best college, but you probably would not have more than 5, 6 interviews, and maybe at the end no more than 2, maybe even 3 acceptances. So most students will get 1 or 2. So therefore, I always tell my medical students, applicants, the pre-medical students that don't worry, all you need is 1. All you need is 1. One medical interview, 1 medical acceptance, you will become a medical doctor in the United States. 20/80 rule. Too many people use this rule in life, in social incidences, but the general myth of success is that they use about 20% of their efforts. They thought they will get into a greater result of 80%. I disagree because I use a rule different, not 20/80, I use 190. What does it mean? My perspective of success is to use 100% of total effort, you will get a 90% chance of success. Let's talk more about it. A lot of students would say, whoa, 20/80, okay? I did do all these pre-medical activities. I worked with nurses, I worked with medical assistants, I shadowed doctors, I scribed type for doctors, I ride ambulance as a EMT, I volunteer in hospitals, I watch surgical procedures, so I'm good. No, in my opinion, that's only 20% of your efforts. Not enough. Too many students would not understand because my rule is about 190 success. So therefore, my question back to them is that, do you understand disease? Do you understand physiology? And most importantly, pathophysiology. Do you perform medical doctor's work? Or did you perform medical doctor's work? Too many students still use 20/80 rule. I did do a lot of laboratory research. I work in laboratory. I work on experiments. I present research project results. My definition of success is 190. So therefore, I ask them a question. Did you invent new drugs? Did you invent new medical science? Were you able to publish the invention in a journal? That is my 190 success, not the usual myth of 20/80 rule. Students may also say, I am a great leader in anything, so therefore I lead school pre-medical club. I raise money for the poor. I tutor younger students. They thought these are societal leadership. I disagree because I always ask them back, did you make change in the healthcare delivery system? Did you facilitate healthcare access to help more people to get medical care? That is leadership. So therefore, to become a medical doctor in the United States, we're talking about a fit. A fit for what? Do you have intelligence? Intelligence is defined by IQ, EQ, and also my definition of SQ and CQ, social intelligence and creative intelligence. Research, diseases, as well as invention. These are the fit of personal quality and professional preparatory quality to become a medical doctor in the United States. The myth would be a lot of parents and students say, I help people. I love helping people. I watch doctors doing surgery. I did hospital volunteer work. I love doing experiments and all that. I work in clinics. I have great GPA. So I should be a medical doctor without problem. I disagree. Because on the other hand, just like my experiences with medical school admission process, medical school admission committee is really looking for your motivation, looking for your commitment, looking for your innovation, invention, and also looking for your contribution to society and your contribution to medicine and to that particular 1 or 2, maybe even 3 medical school eventually that you will be able to get in. So please think a little bit more clearly of what is the 190, 100% effort, 90% chance of success. It's not just about a person's GPA and MCAT score. Conquering the 4 myths. Don't let these 4 myths to distract you. High GPA, MCAT guarantee success to medical school admission? No, not true. These are just screening numbers, GPA, MCAT. Once you screen in, it doesn't matter you're 3.8 or you're 3.9 or you're 4.0. The final decision by the admission committee, it really doesn't matter you were a 3.8 or 3.9. MCAT, same thing. If you have a 510, your chance is too small. If you have a 520, your chance is good, but doesn't mean that you will be guaranteed success. You will be able to use your high scores, not in the United States, okay? Maybe in Hong Kong, maybe in China, maybe even in Great Britain, but not in the United States, because there are a lot more US medical school required. Myth number 2, working in clinic, so therefore I have clinical experience. Not true. Too many times pre-medical students work in a clinic, they just shuffling papers, they take care of insurance authorization, they just hopefully they have a chance to watch doctor seeing patients, watch doctor do surgery, etc., and they thought they have clinical experience. I already said that many times. That is not true. Do you understand the clinical process? Do you understand diseases? Do you understand how to conquer diseases? Myth number 3, even more significant. Too many students and also parents said, my son and daughter, or I myself, I love helping people, so therefore this is the reason that I need to and want to study medicine. Wow, helping people? Too many professions actually are helping people. What about teachers? What about nurses? What about social workers? They all help people. If you don't know how to use medical knowledge and experiences in clinical setting to help patient disease, that is not study medicine. That is not medicine. Myth number 4, working with laboratory experiments, I really know how to do my techniques. So therefore, I will be and I should be doing medical innovation, medical invention. Absolutely not true. Doing experimental work in a laboratory just means that you have good techniques, right? But it doesn't mean that you know how to yet apply the medical invention. Hopefully someday there will be, onto conquering diseases. Be careful. Too many students said, I worked for 1 year in a professor's lab. Okay, so therefore I know what is medical innovation. That is not true. Too often, the student will also even pick a professor who is a PhD and not an MD. So therefore, the research is more like basic science. It's not clinical science or be able to apply to diseases, and that is not a success factor. So let's talk about the 6 key success factors. GPA, MCAT, you're on your own. I'm not going to talk about it, how to study, how to get scores. But I insist you must have meaningful clinical experiences, medical research, and you must be able to use all that experiences and knowledge onto contributing to society and contributing to the medical school you will be able to fit in. Remember, you can only get into 1, 2, probably no more than 3 medical school on your application process. So therefore, key success factor number 1, GPA, you're on your own. But remember, GPA, medical number 3.8, so don't get too many B's, and please don't get C's. Number 2, MCAT score. Too many students and parents will say, do I need to prepare? When should I take it? In my junior year or in my senior year? My return answer is that always MCAT has to be higher than 518. If you have 517, okay. 516, okay. 510, no, that's not okay. Also, you got to prepare early and make sure you don't take more than 2 times because you really don't have the chance. If you take 3 times or 4 times, what if your score go up and down? And that really only show your weakness and doesn't show your strength in your academic skill. Number 3, clinical experiences. Do not just help nurses. Do not just help the medical assistants in the clinic. Those are not clinical experiences. Don't just do paperwork, get authorization on insurance, shuffling charts. Don't just compile patient statistics for the medical clinic. That is not enough, and that's not clinical work. These are good clinical work. You should work under a medical doctor. The medical doctor hopefully will take the time, be kind to show you a few clinical skills and clinical process. Many times I take students into my work, into my surgical unit, into my own medical office. I explain to them all these clinical processes. Take notes after you see a disease. What is hypertension? What is diabetes? What is stroke? Spend time to talk to patients, to understand their illnesses, their concerns, their complaints. That is clinical experience. Number 4, medical research. Don't just work in a laboratory a couple days a week, or maybe even a whole year. Take your gap year and work in a professor's laboratory. If a professor is a PhD, more than likely he won't be able to do medical work. If a professor is MD, the chance is better. Don't just get busy. Make sure your medical research eventually will have a translational result, meaning that the results should be able to apply to diseases and understanding of diseases and hopefully conquering diseases. Clinical study is very important. Your medical research needs to be involved, related to diseases, clinical study. It's okay to do data analytical work on diseases. That means that not just to know the usual percentage, but you have to analyze the disease. What is important? What are the different subtypes of patient in each diseases? You can do even something called statistical meta-analysis, but make sure it's all related to clinical outcome or medication use for these diseases. Make sure in your medical research is applicable to population and community, and is translational enough, so-called, from bench to bedside. That means from a laboratory, need to go to patients and populations, real people. And hopefully your research work can be published in a journal. You can present it in a conference. And most importantly, you need to be able to incorporate and write it down in your application essay and discuss about it with the admission committee. Number 5, contribution to society. Success factor involve a direct patient care improvement, medical science advancement, or medical invention. Hopefully you'll be lucky to work with a Nobel Prize winner in physiology or medicine. Hopefully you will be able to work with a pharmaceutical advancement. So these are definite contribution to society. Your work should be about public good. Your work should be about community health improvement. Your work should be about societal impact and improvements. Number 6, contribution to school. Your work need to be apply to your school class. So you're not just a number, you're not just a person, but you should be able to share your experiences with the rest of your medical school class. And your academic skill will be able to bring to the understanding of all the other students that you understand diseases as well. Medical school training is about from basic science to clinical science and then about diseases. My work with students, I do a lot of consulting work for medical school and to help students to be successful in their pre-medical work. First is clinical. We already understand what are the myths in clinical work, the myths in so-called helping people. So therefore, your clinical work needs to be meaningful. You have to understand diseases. You have to be able to work with a medical doctor, not just with a nurse. Your medical research in the laboratory need to have invention, need to have results. And all these need to be all linked back to certain diseases advancement, meaning that your clinical understanding, your laboratory research with inventions, hopefully all tie into the fact that you will become a disease expert. Of course, you're a student. You are student disease expert. You are disease student expert. And eventually you understand how to conquer, how to advance medical science to control diseases. And that is the meaning of becoming a medical doctor. More meaning concerning how and as a medical doctor is that you are working for the public. You're working for others. You're working for patients. you're working for local community, you may be even working for global population. For example, indeed, if you were lucky enough to work with the COVID vaccine, right? You're not just helping US population, you're helping the whole world on controlling, on preventing COVID. At the same time, you're also working for yourself. It's about self-satisfaction, it's about self-pride. What is this? It's about a passion in learning medicine. The passion is the reason why you want to study medicine, why you want to go to medical school to learn medicine. As a doctor, you're working for others, but at the same time, you're really working for yourself. In the process, you need to use your IQ to develop your vision of the future, how to become a medical doctor with a certain interest in diseases. You have to use your EQ to make plan for the society, to make plan for your learning of clinical and medical research. You have to use your CQ, meaning that you have to know how to use focus. You have to know how to use diseases' interest to advance to be an expert for the future. You have to know how to use strategy to understand your work is really meaningful to the society. This is a successful pre-medical preparation. Vision, plan, focus, strategy. IQ, EQ, CQ, SQ. Successful application essay and interview need to go through strategy, need to show your competitive advantage, you need to show your unique experiences, you need to show your passion and your focus in medicine. I've helped so many students in the last 20 years to go to top MD medical schools. And at the same time, I also help many students go into DO medical schools. My DO pre-medical students are very successful. Most of them get 6, most of them able to get 12, 100% success. And my preparatory work for myself before I became a consultant, I obtained the various training besides my Princeton degree in chemistry. I also, of course, I went to medical school, but at the same time, I learned about business, public administration, psychology, organization development, as well as law. All these skills actually helped me to be a great consultant because I look at a student and their family as a unit, and I would be able to use so-called group psychology to help them develop their pre-medical plan. No more myths. It's all about success factors. No more 20/80. It's all about 190. I do have a particular pre-medical mentorship program that I help students to understand clinical processes, clinical care, and clinical research. I lead them on understanding what are the processes that doctors are helping interviewing patients, how to do examination, and how to do disease analysis as well as future research. This is a very specific mentorship program. The 6 key success factors: GPA, MCAT, clinical experiences, medical research, contribution to society, contribution to school. You must have these key success factors to go through your pre-medical work so that you'll be very successful in your medical school application. My work is about 90% acceptance to MD medical schools. My work is about 100% acceptance to DO medical schools, and my younger students able to get into combined program, BSMD. I'm always very proud of my work because I use myself as an example. When I was young, a naive student at Princeton, I did not know all these success factors. I probably did a lot of myths in shaping my work, in how to prepare for medical school too. Yes, I did have my GPA. Yes, I did have my MCAT score, but I'm not sure I understood everything concerning success factors. But today, I want to share with you, because of my 20 years experience in helping 90% success chance of my MD pre-medical students and 100% of my DO pre-medical students, as well as BSMD high school students. I know what is this now. And also from my experiences on the admission committee at UCLA Medical School, Mount Sinai Medical School, and way back in Princeton University, I dare to say I should be able to share with you all these success strategies. Good luck in this process. Medicine is fun.